Welcome to Hope Care and Love Home Healthcare Services Medication Management Training. Over the next few days, you will be watching several videos that will teach you how to safely pass medication. Along with the videos, you'll receive hands-on instruction along with homework assignments where you'll review information that is pertinent and important to safely passing medication. You will have a trainee task record that we will review during your medication handoff. You will learn how to prepare and function as a medication aid. You will have a basic understanding of how to cluster facts. And you will have learning methods that you'll be able to utilize while you're passing medication. And at the end, you will have an evaluation. There are 5 duty areas that you will be training in. You will be training in duty area 1, which is preparing to function effectively as a medication aid. You will function with duty area 2, which is maintaining aseptic conditions. Duty 3 is facilitating client and resident self-administering or assisting with medication administration. Duty area 4, which is assisting the client or resident with self-medication administration and preparing installations and treatments. And the last area is understanding diabetes. A couple of things to remember is, above all else, follow your 5 rights. And what are your 5 rights? Take a moment to think. And if you don't have paper and pen, get your paper and pen out. So when you're preparing your medication, there are a few ways to remember it. I like to think of it as I'm going in sequence. So when I am pulling my medication out, I am not only ensuring that I am pulling out the right medication at the right time, I am making sure when I pull the medication, I am pulling the right drug. I am going to pull the right dose. Then when I go to the right resident, I am giving it at the right time, okay? So you should have 5 rights: the right resident, the right drug, the right dose, the right route, and the right time. There is a 6th right that people often forget. It is the right to refuse. And if someone refuses, it is very important that you document accordingly. You want to document your attempts, and you want to document exactly why they have chose to refuse. It could be something as simple as they don't agree with the color, and that is okay. They have the right to refuse. Another important medication management or medication aid reminder is, when in doubt, don't. If you're not quite sure about something, don't do it, okay? And I cannot stress it enough. Read your label, read your label, read your label, read your label. Do what? Read your label. Alrighty. There's a way to remember your rights. It's called R2D2 plus T. So R2, which is the right resident. D2, drug and dose. And right resident, right route, right drug, right dose, and time. R2D2. There's 2 R's, there are 2 D's, and there's a T. R2D2. Okay? Very, very important. I will ask that over and over again. Okay. So you want to ensure that you are being confidential when you're passing your medications. You want to make sure you are making decisions that are specific to your individual or your client. You want to give privacy. You want to maintain confidentiality. You want the individuals to participate in their care. Also keep it in mind, they have the right to refuse treatment. They have the ability and the right to choose their caregivers. Yep, they have the right to choose their caregiver. And they have the right to move around freely. Always remember their rights and their medication management rights, okay? Always remember that you are responsible for upholding the residents' rights. You are responsible for assisting with the medication administration in accordance to the curriculum, okay? Alrighty, so I'm going to stop there, and then we're going to go into emergencies.